If you're over 55, what you do before bedtime might be putting unnecessary strain on your heart without you even realizing it. A cardiologist recently revealed 5 common nighttime mistakes that could be affecting your health in ways you never imagined. Many people in our generation have developed bedtime habits over the years that seem harmless, but may actually be working against our bodies during those crucial hours of rest. Our hearts, circulation, and overall health depend on quality sleep. Yet simple mistakes we make each night could be preventing our bodies from getting the restoration they need. As we age, our bodies become more sensitive to these disruptions, making it especially important for those of us over 55 to pay attention to what happens during our nighttime routine. Have you ever wondered why some people in their 60s and 70s seem so energetic and healthy, while others struggle with various health challenges? Could there be simple bedtime mistakes that many of us make without realizing their impact on our heart health and overall well-being? What if small changes to your nighttime routine could help you feel more rested and healthier? Stay with me until the end to discover these 5 critical nighttime mistakes and learn practical solutions that could make a real difference in how you feel every morning. Before we begin, please subscribe to our channel and ring the notification bell. Let us know in the comments what part of the world you're watching from. We'd love to connect with you. Understanding how our bodies work at night becomes increasingly important as we get older. During sleep, our heart rate typically slows down, our blood pressure decreases, and our bodies focus on repair and restoration. However, certain habits can interfere with these natural processes, forcing our cardiovascular system to work harder when it should be resting. Research from respected medical institutions shows that poor sleep quality is linked to increased risks of heart problems, high blood pressure, and other health concerns that become more common after age 55. When we disrupt our body's natural nighttime rhythm, we may be unknowingly putting extra stress on organs that need rest to function properly during the day. Let me share with you the 5 nighttime mistakes that Dr. Bella, an experienced cardiologist, identified as particularly concerning for people in our age group. Mistake number 5, frequent nighttime urination, particularly when caused by fluid buildup. Many people over 55 experience this issue, often waking up multiple times during the night to use the bathroom. While this might seem normal with aging, Dr. Bella explains that frequent nighttime urination can sometimes indicate a circulation problem that deserves attention. During the day, if you have swelling in your legs or ankles, or if you have varicose veins, fluid can accumulate in your lower extremities. When you lie down at night, this fluid gets reabsorbed back into your bloodstream, which then puts extra work on your kidneys and heart as they process this additional fluid volume. This process can strain your cardiovascular system during what should be a restful period. The solution involves a simple but effective approach that many people find helpful. About 2 to 3 hours before bedtime, try elevating your legs for 40 to 50 minutes. You can do this by lying on your couch with pillows under your legs or sitting in a reclining chair. This helps encourage the fluid to redistribute before you go to bed. Additionally, modify how you drink water throughout the day. Instead of drinking large amounts in the evening, spread your water intake throughout the day, then reduce it significantly 2 to 3 hours before bedtime. This combination can help reduce the number of times you need to get up during the night, allowing for better sleep quality. Furthermore, Dr. Bella suggests incorporating light exercises during the day to improve circulation, such as walking or stretching. The more you stimulate blood flow throughout the day, the better your body can handle fluid redistribution at night. By following these simple adjustments, you may not only improve your sleep quality, but also support your overall cardiovascular health. Mistake number 4, eating dinner late and going directly to bed. This habit forces your digestive system to work intensively when your body should be winding down for rest. When you eat a meal and then lie down soon afterward, your stomach has to work against gravity to process food, which can lead to acid reflux and heartburn. More importantly for heart health, late eating can elevate your stress hormone levels, including cortisol, which can increase your heart rate and blood pressure during the night. Studies have shown that people who eat late and sleep soon after have higher risks of heart problems and strokes. This happens because your body is trying to digest food while also trying to enter the restorative phases of sleep, creating conflicting demands on your system. Dr. Bella recommends finishing your evening meal at least 2 to 3 hours before bedtime. This gives your digestive system time to process the food before you lie down. If you must eat something closer to bedtime, choose something very light like a small piece of fruit or a few crackers, and try to remain upright for at least an hour afterward. In addition to this, Dr. Bella emphasizes the importance of avoiding heavy, greasy foods in the evening, as they can increase the risk of indigestion and disrupt your sleep cycle. Instead, opt for foods that are easily digestible, such as lean proteins and vegetables. Incorporating a light walk after dinner can also help the digestive process, easing your stomach and preparing your body for rest. It's essential to give your body the time it needs to wind down fully before going to bed, allowing it to enter deep sleep without the added stress of digestion. Mistake number 3. Sleeping in positions that strain your body, particularly sleeping on your back if you're overweight or have acid reflux issues. As we age, the position we sleep in becomes more important for our health. Sleeping on your back can worsen sleep apnea, a condition where breathing briefly stops during sleep, which is more common in people over 55, especially those carrying extra weight. When you sleep on your back, gravity can cause the soft tissues in your throat to collapse backward, blocking your airway and causing snoring or sleep apnea. This forces your heart to work harder because it's not getting adequate oxygen, and it can raise your blood pressure throughout the night. This can lead to a variety of other issues, such as fatigue, headaches, and even cardiovascular strain over time. Additionally, improper sleeping positions can exacerbate pre-existing conditions such as arthritis, joint pain, and nerve compression, further impacting your overall quality of life. For individuals with acid reflux, sleeping on your back is even worse because the stomach acid is more likely to flow back into the esophagus, causing discomfort and potentially leading to esophageal damage if left untreated. Sleeping on your stomach is also problematic because it can strain your neck and alter the natural curves of your spine, leading to back pain and poor circulation. The ideal sleeping position, according to Dr. Bella, is on your left side with a pillow between your knees. This position helps with acid reflux because it keeps stomach acid from flowing upward, improves blood flow back to your heart, and reduces snoring. The pillow between your knees helps keep your spine aligned and reduces pressure on your hips and lower back. By adopting this position, you can reduce discomfort, improve sleep quality, and support your overall health, ensuring you wake up feeling more refreshed and ready for the day. Mistake number 2. Getting up too quickly from bed, especially dangerous for those over 60 or anyone taking blood pressure medications. This seemingly innocent action can actually be quite risky due to a condition called orthostatic hypotension, where your blood pressure drops suddenly when you change positions quickly. As we get older, our cardiovascular system doesn't adjust as quickly to position changes. When you've been lying down for hours and suddenly stand up, blood can pool in your legs, temporarily reducing blood flow to your brain. This can cause dizziness, blurred vision, or even fainting, which can lead to serious falls and injuries. The risk is particularly high for people who take medications for high blood pressure or diabetes, as these medications can make the blood pressure drop more pronounced. This sudden drop in blood pressure can also contribute to longer-term health complications, such as increased risk of heart attacks and strokes. Dr. Bella teaches a simple 20 to 30-second rule that can prevent these dangerous situations. When you wake up, sit on the edge of your bed first and move your arms and legs gently to get your circulation flowing. If you have water by your bedside, take a small sip. This helps to hydrate and assist your body in adjusting to the change in position. Wait about 20 seconds, then stand up slowly and wait another 5 to 10 seconds before you start walking. This gives your cardiovascular system time to adjust to the position change and can prevent the dizziness and falls that send many older adults to the emergency room. The practice of waiting for a moment allows your body to adapt to the standing position, reducing the chances of dizziness or fainting. It's a simple yet effective strategy that can make a significant difference in preventing accidents and improving overall circulation. especially for individuals who may be dealing with other health conditions. Mistake number 1. The most concerning mistake, according to Dr. Beller, is the inappropriate use of sleep medications, particularly drugs like diazepam, alprazolam, and clonazepam. Many people in our generation started taking these medications during stressful periods in their lives, sometimes without proper medical supervision, and have continued taking them for years. While these medications can provide temporary relief from insomnia, long-term use creates several serious problems. First, your body develops tolerance, meaning you need higher doses over time to achieve the same effect. This escalation can lead to dangerously high doses, increasing the risk of side effects and overdose. Additionally, the medications can impact your cognitive function, leading to forgetfulness, lack of concentration, and even confusion in some cases. Second, these medications don't actually provide natural, restorative sleep. Instead, they sedate you, which means your brain doesn't go through the proper sleep stages needed for physical and mental restoration. This can leave you feeling foggy and unrested the next day, despite having slept for 8 hours. The brain, when sedated, misses the deeper stages of REM and slow-wave sleep, which are vital for muscle repair, immune function, and cognitive restoration. Third, these medications can worsen snoring and sleep apnea by relaxing the muscles in your throat too much. When these muscles relax too much, it can cause your airway to collapse more frequently, exacerbating breathing difficulties during sleep. Most importantly, dependency develops over time, making it extremely difficult to sleep without them. Over the years, your body becomes reliant on the sedative effects of the medications to fall asleep, and without them, it can be nearly impossible to achieve natural sleep. If you've been taking sleep medications regularly, Dr. Beller emphasizes that you should never stop them suddenly, as this can cause dangerous withdrawal symptoms, including anxiety, agitation, and, in severe cases, seizures. Instead, work with a healthcare provider to gradually reduce the dose over time while implementing natural sleep improvement strategies. This might involve cognitive behavioral therapy for insomnia, developing a healthy sleep environment, and addressing the root causes of stress and anxiety that originally led to the need for medication. This approach ensures that you can sleep more naturally and healthily without becoming dependent on sedative medications. Now that you understand these 5 mistakes, let me share Dr. Beller's practical approach to improving your nighttime routine safely and effectively. Start by implementing the 20 to 30-second rule every morning when you wake up. Keep a glass of water by your bedside so you can take a small sip after sitting up, which helps with circulation. For the leg elevation technique, use firm pillows or a wedge pillow to raise your legs about 6 to 8 inches above your heart level for 40 to 50 minutes before bedtime. You can read, watch television, or simply relax during this time. Regarding meal timing, if your work schedule or family commitments make it difficult to eat dinner early, try to make your evening meal smaller and avoid heavy, fatty, or spicy foods that are harder to digest. When it comes to sleep position, if you're not used to sleeping on your side, start by placing a pillow against your back to prevent rolling over, and use a thin pillow between your knees for comfort. If you currently take sleep medications and want to reduce or eliminate them, schedule an appointment with your doctor to discuss a gradual reduction plan. Never attempt to stop these medications on your own. Dr. Beller also recommends 6 essential practices for natural sleep improvement. First, maintain consistent sleep and wake times, even on weekends. Second, get sunlight exposure in the morning to help reset your natural body clock. Third, avoid caffeine after 2 or 3 in the afternoon, as it can stay in your system for up to 8 hours. Fourth, eliminate blue light from phones, tablets, and televisions at least 2 hours before bedtime. Fifth, practice the correct sleeping position we discussed. Sixth, address stress in your life, particularly toxic relationships or situations that keep your mind racing at night. While these recommendations can be very helpful for most people, it's important to understand when to seek medical attention. If you experience chest pain, severe shortness of breath, or irregular heartbeats during the night, contact your healthcare provider immediately. People with existing heart conditions, diabetes, or those taking multiple medications should discuss any sleep-related changes with their doctor before making adjustments. If you're currently taking prescription sleep aids, particularly if you've been using them for months or years, professional medical guidance is essential for safe reduction. Some people may have underlying sleep disorders like sleep apnea that require medical treatment beyond lifestyle changes. Thank you for taking the time to learn about these important nighttime habits that could be affecting your health. If this information was helpful, please give this video a thumbs up and share it with friends or family members who might benefit from knowing about these nighttime mistakes. We'd love to hear in the comments about your own experiences with improving your sleep routine. You'll notice we have 2 videos on the screen now, and I'm sure you'll find valuable information by continuing to watch more content like this. Take care of yourself, and remember that small changes in your nighttime routine can make a big difference in how you feel each day.